My mother just had knee replacement surgery 2 weeks ago. Last week, during the middle of the night, my mother called me 1 o'clock in the morning and could hardly breathe.
Resident Beverly Greenwood spent years worrying that her mother lived far from the nearest medical facility.
The time span that it took them to leave my mother's house and get to Touro Hospital, which we live in a close proximity of this facility, so I would still say it's about a 12-mile journey to get there. It could have made a difference between life and death for her.
It's been almost 9 years since New Orleans East has had a full-service hospital.
I'm a heart patient. You have to cross the interstate, and go to the interstate, cross the industrial canal, go down to Tulane. On a good day, it'll take you 20 to 30 minutes. The real problem is that it changes the quality of life. It's a fear factor.
This fear element also greatly impacts the elderly community. In 2010, the LaFawn Nursing Facility reopened.
Working here at LaFawn, sometimes when we have emergency type 911 calls, my concern always be, will the resident get to the nearest hospital in time? When it's a 911 call, we initially start the CPR, and one of the other nurses go and call for 911. Usually the time limit for them to get here, then plus when they get here, they take over because they have all of the necessary equipment. It usually runs about 20 minutes before they can get them out the building.
This June, a $110 million new hospital is set to open in New Orleans East, which is home to 77,000 people. In the meantime, a clinic has been offering services during the day, but longtime residents are dismayed and anxious as the full-service facility has been 9 years in the making.
I was part of a group that actually formed the New Orleans East Hospital District. The whole activity for it was funded by Methodist Healthcare Foundation, who I think it's over $1 million that they donated for studies and a variety of things that had to take place before you could actually plan the hospital.
Hospital planning began immediately after Hurricane Katrina, but plans dragged on as changes in political leadership complicated the process in place.
We had several what we considered ace proposals that were available, but the then mayor, Ray Nagin, just never acted on them.
There was the economic question of whether or not the hospital would be economically viable. There were disagreements about how to put together the hospital. That is, who should be in control, who should the management partners be, who should be on the board of directors. As a matter of fact, one group of people went a long way down the road thinking that they were putting together a project. When the new mayor, Landrieu, came in, he pretty much dismantled that effort and put together another team that to a certain extent had to go over much of that work again.
Construction finally began in 2013. The hospital will join other new businesses in the area. Currently, a Walmart is being built on the lot where the old Lakeland Hospital previously existed. The city expects the new 215,000 square foot hospital to promote economic development in the area.
If you're building a community, one of the things you need to have is good medical care. Once the community is stable, other businesses are willing to invest. What we have gotten and what we will get open this month are two major pieces to the puzzle. One is the hospital, one is the Walmart.